I don't give any medical advice in relates to that. But phentermine's, phentermine and phentermine-like medications that are sympathomimetics, meaning that it can increase your sort of adrenaline levels and noradrenaline, which is sort of like the sister of adrenaline, norepinephrine. Um, it can help people reduce the amount of hunger they have in relation to meals or throughout the day. It can also help people feel kind of generally more satisfied. Um, and so, yeah, I think that's generally how it works. It works, it works well. It works if it works well for you, and you're someone that needs a little bit of kind of support that way. That you've been really good on trying to hammer down all those things that are important. Working on cutting out the processed food, like I talked about. You've been really working on optimizing your home living environment, so you remove sort of temptations, that you have sort of a healthy living environment. Then yeah, phentermine can be a good boost, especially if you're someone who feels like their metabolism is a little bit slower. There are some ways we can objectively measure that, but for people who typically have a slower metabolism, they may respond actually better to phentermine than some of the other drugs that are listed. How long to see results from phentermine? Phentermine is pretty fast acting, so if you are going to respond to it, you should know usually within the first week or two. It's possible that you're not on the appropriate dose, so that's something else to consider. Maybe you need a higher dose to have sort of full effects. Usually people start off at 15 milligram dose. That's usually kind of the intro dose, beginner dose for phentermine. Contraindications. The biggest one is probably active cardiovascular disease. In general, we try to shy away from phentermine for people who have a history of heart disease. So if you've had a history of stroke or heart attack in the past, we try to avoid it because it can cause an increase in sort of the cardiovascular system and the activity within that. It could exacerbate existing heart disease. So that's the biggest one. I would tell you it's not an absolute no, but I think for most doctors, they'll shy away from it in that case. It's the biggest one. Other things like recently taken special drugs called MAOIs, if you have active thyroid disease, typically like hyperthyroid disease. There's some other indications. Glaucoma, you shouldn't be taking it. So there's a lot of stuff, but that's also why it should be prescribed by someone who knows what they're doing and who's familiar with the drug so they know that it's safe. But most people don't have active thyroid disease, active heart disease, have glaucoma. So a lot of people are good candidates for phentermine. It's a really safe drug. We have like 70 years of safety data going back to like the 1950s. People have been taking phentermine. It's very safe. Its counterpart, which was fenfluramine, that was found in the sort of that popular weight loss drug in the early 2000s, late 90s. That's that fenfluramine component that phentermine was a part of. That was the drug that got a lot of people really sick, and that's why it got pulled off the market. But phentermine's never been pulled off the market. It's never been shown to have those same sort of side effects that fenfluramine does. So yeah, it's a very, by all accounts, we have a very good understanding of what it does and the risks related to it. IC, it's FDA approved for short-term weight loss, less than 3 months. But I would tell you, all of the experts in my field use it, often use it long term if we're going to use it. Yeah. So we use it off label for that reason. I think I would have to go look and see why they approved it for short term, but I suspect some of it's related to the fact that phentermine, people can develop a tolerance to the effects, meaning when they were first taking it, they had a very profound appetite response to that. And then within a few months, maybe it's less pronounced. And so they lose sort of that effect. What you see a lot of people do, people in my field, is they will cycle on and off. Like you would do that for maybe like caffeine. If you develop a sort of a tolerance to caffeine, sometimes people will like cut down and stop it for a few weeks so that they build up a sensitivity again and then they can take it again. You can do that with phentermine too. There's no harm in stopping phentermine. You can stop it right away without issues. So that's a benefit. Not all medications you can do that, but phentermine you certainly can. I firmly believe if you look at how these drugs work, people want to describe them in any number of ways, sometimes very crudely. It's an appetite suppressant. It just squashes your appetite or it boosts your metabolism. Okay, maybe there's a component of that, but if you look at the mechanisms and you read the science around it, and then you look at sort of the clinical experience I have with patients, part of the reason why people can't lose weight, and I talked about this in a recent video, is that when you try to lose weight, your body resists weight loss because it gets comfortable. It develops this comfort zone that we call sort of the set point. And that set point where your body defends any changes to the weight is much more robustly defended against changes against weight loss than it is against weight gain, which makes a lot of sense to you all. You guys all know it's much easier to gain weight than it is to lose weight. But we know there are some people that have a very, very hard time gaining weight. In fact, their bodies are very robust in defending them. Those people, it's much more rare, but they're definitely sort of variants of people that have that. But your body likes your weight to be within a certain range, and it will enact a number of changes, both from your metabolism standpoint as well as your appetite, and a number of changes within sort of your brain physiology that makes you eat more, crave food more, desire food more, emotionally eat more, all of those things. So when you say, I'm taking this drug because it's suppressing my appetite, I mean, it's just a very crude way of saying it. What I think is a more accurate depiction, if you look at sort of what the evidence suggests and what I see with patients, is that what you're doing is you're lowering that biological set point so that their body just feels more comfortable and operates basically at normal levels at a lower weight. So what I mean by that is when you are, let's say, when you've lost 20 or 30 pounds because you're taking something like Saxenda, at that reduced weight, if you weren't taking that medicine, you would be hungry, you might be craving foods all the time, you might be feeling miserable, your energy levels might be miserable, you might be feeling sluggish, fatigued. We see that, and that's part of the body's response to you trying to lose weight. Once again, your body is resisting that weight loss. When you're taking medicine, what it does is it starts counteracting a lot of those physiologic changes that are occurring that makes it so miserable to be at a reduced weight, right? That is fighting your ability and your good intentions to lose weight. So when you talk to people who are on effective drugs that work for them, what they inevitably tell you is that I, I've never tried to lose weight and it be like even enjoyable. This is the first time it's been sort of even enjoyable and not been insufferable and not made me feel miserable and made me feel terrible. And so I think what that suggests, both from my clinical experience and also looking at the science, is that what you're seeing with medications is it's lowering that set point. Your body is saying, okay, no longer do I have to live at 250. I can live at 200 pounds and be happy and comfortable and not be miserable. And that's really why I talk about it. It's much more effective, I think, to say that it helps lower your body's comfort level, or lowers sort of the level at which your body is comfortable in terms of body weight. So I think that's a better way. It lowers that sort of biological set point, and your body just can operate better at a lower weight. It's not fighting you. I think that's the best way to describe it when you talk about how these medications work. So yes, are there changes to appetite? Are there changes to metabolism? Are there changes to the way that you perceive food, that you literally objectively evaluate food, its taste? Yeah, all of those things. And I think the cumulative effect of all those things is that people feel like they can just function at a lower weight. That's my take. I would say just because one medication doesn't work for you does not mean that all medications will not work for you. What we see oftentimes is that if you don't respond to one, you likely will respond to another. And so sometimes it is a little bit of a trial and error. I previewed a study that is looking at pairing the right medicine with the right person based upon certain test results. So scientists are looking at this question. They're looking at, is there a way that we can test people and figure out, okay, that person's gonna respond better to this drug. And so that science is being developed. I would say it's very early on, But the early results suggest, yeah, there are going to be people that respond better to certain medications. And just because you don't respond to one does not mean you won't respond to another. So if you're frustrated that everybody is having a great response to a certain medication, doesn't mean you won't respond to a different one if you don't respond to that medicine. You get to decide what you do with your body, no one else. If you don't want surgery, it's up to you. No one forces you to have surgery except for you. If after having an extended conversation with your surgeon, your doctor, I'm assuming that refers you to the surgeon, if after having an extended conversation talking about the benefits, the risks of surgery, how it may change your life moving forward in terms of having to take things like supplements for the rest of your life because of some of the malabsorption that occurs with bariatric surgery. If after all that, you guys collectively make an informed decision that it's in your best interest to have surgery, then have surgery. If after all of that you have concerns, are nervous, would like to try other options, listen, it's your life, your body, your choice. No one gets to make that decision for you. Only you get to make that decision. So if you take anything away from this conversation, it's all optional. Even if a doctor scares you to death and says, if you don't do this, you're going to die. No, it's all optional. Is there very clear evidence that certain individuals will benefit from surgery, will decrease their chance of death, cancer, cardiovascular disease, kidney dysfunction? Yeah, there's very clear. That's why we refer people for surgery. That's why they benefit from surgery. Is it